consultant. I'm practicing since last 11 years in Bangalore. Okay. I'm currently working as a senior lactation consultant in the Rainbow Children's Hospital in Bangalore. And I have work experience in 11 years with, I'm also work in a motherhood child care hospital also. So I have my own practice of the as a lactation consultant. So today I'm going to talk about the tips for the nipple care while the breastfeeding, which is a very important for the first primary, which are the mothers which are the first time delivered. It is a very important. So basically, the nipple care, how to take the care of the nipples means what we do. First, before the breastfeeding, okay, the nipple should be very soft, because if the nipples are hard, the baby will not able to latch properly. Okay, so while the breastfeeding, always do nicely the breast massage, do the nipple stimulation, remove a few drops of the breast milk and just apply at the base of the nipple and at the tip of the nipple, so your nipple will get soft. Okay, then there are the so many causes for the nipple soreness, or the so many mothers came with the complaints of, ma'am, I am having the nipple soreness, tenderness, cracks, itching, redness. These all are the complaints which are related to the nipples. Okay, so first I'm going to tell you about the transient soreness period, which is a very necessary after the first postpartum first few days. uh, Within the 1 week after the postpartum, the mothers appears with the tenderness, hard nipples, okay, while during the hand expression. So why it is? It is due to the pregnancy hormone changes and the hormonal changes during the postpartum period, and it lasts for the 3 to 6 days specifically. So the proper feeding position, proper mother's breastfeeding position, and the correct baby's opening the big mouth and the proper deep latch technique is very important for this. Okay, so the mother will not get any nipple injury or the nipple trauma. Nipple soreness and the nipple pains is a very common reason for the early weaning of the breastfeeding. Okay, so we have to take care nicely for the nipples. Don't let the nipple injure and the hurt. So there are the other another causes for the nipple pains, like the improper latch, then the oral anatomy of the baby. You have to see for the any tongue tie, the suction is improper while baby is sucking and the latching. Then if baby is having the tongue tie and the cleft lip and cleft palate also, the anatomical changes in the mother's nipple also, it is very important. Some mothers is having the flat nipples, some mother is having the inverted or the dimple like nipples. So you have to do the breast examination in the last trimester, which is a very necessary to avoid the further crack or injury or any hurting for your nipples. Okay, then again the engorgement. Due to the engorgement, the nipple will get hard. So there is some mothers having the nipple pains. Baby is not able to latch that time due to the full engorgement. The milk is full stagnated around the dark part, that is the areola. Okay, then also there is a thrust, that is a fungal infection. In this condition also the mother will suffer from the nipple pains, or there is a redness or the itching also there. Then if mother is having the cracked nipples, so there might be chances of the bacterial infection also. So whenever there is any pains or the crackness or the nipple injury after the transient period of the soreness, okay, means first 1 week after the postpartum, if you are suffering from, after the postpartum you are suffering from the nipple injury or the nipple pains, immediately you can consult your nearby the lactation consultant, which is very important. Then I would like to tell you regard the improper latch. Okay, if baby is only opening the tip of the nip, only few mouth like this only. Okay, the baby is only taking the tip of the nipple. Means now I'm going to tell you the tips for the nip to avoid the injuries. Like now I have this the breast model. Okay, The baby should be latched deeply, means the baby's upper lip and the lower lip should be wide open. If baby is taking only this much, opening this much mouth, it means the baby is only taking the tip of the nipple. Baby is not taking the maximum part of the areola. Okay, so it is also main cause for the nipple injury. Okay, so just watch for the deep latch techniques. There are the few points for the deep latch techniques to avoid the nipple injury. The baby's first thing, baby's mouth should be wide open. Second thing, there is no any clicking sound like if baby is doing the clicking sound, it is an indication that baby is only taking the or sucking your tip of the nipple. So when the baby is only sucking the tip of the nipple, immediately the baby will bite your nipple and baby will cause your hurt your nipples. Okay, so just remember, wide open mouth. Second thing, there should not be any clicking sound. Always chin is touching to your breast. Okay, this is a very important for the proper and good latch. Then fourth, there should not be any dimple on the cheek. Okay, if there is any dimple on the cheek, clicking sound, it means this is a narrow and improper latch. This is not the good and perfect latch. That time baby will bite your nipples. So just watch all these things nicely while the feeding. This is your baby. Okay, this is your baby, the and this is a breast. The baby should be towards you. Your shoulder and elbow should be in the one line, and don't bend forward. If you bend forward, uh, you're worried about the baby's nose that time. Okay, so you are changing the nipple position and the breast position automatically because you are worried about the baby's nose. So always sit properly and always go with the deep latch technique. Okay, so what will you do to take care of your nipple if you are having the dry and the hard nipples, or if you are having the tenderness of the nipples? Always you can just slightly do the breast massage first nicely. Okay, then always at the base of the nipple, slowly just do the nipple stimulation. Then do the hand expression, that is place one finger here and it just push back and squeeze nicely. Remove the few drops. Just rub on the baby's lips up and down. The babies are very smart and intelligent. Immediately, when they get the smell and the taste, immediately open the big mouth and then just insert your nipple. So your nipple will not get injured or baby will not bite your nipple. Okay. So this is a special tips that how to open the big mouth of your baby. Just express few drops, just push back and squeeze, express the few drops. The tip of the nipple just rub on the baby's lips up and down, side to side, from the nose to down continuously. Make him open the big mouth and then just insert your nipple. So you will not get any nipple injury. Then when there is any crack or anything, you can just consult your, after, if you are having the full milk let down, full milk, and if there is a crack and still you are having the pains, the proper person will guide you is a lactation consultant. Okay, so the prevention is always better than cure, so need to consult your lactation consultant. Okay, then if there is a dryness, just always put the just always put the milk at here the down areola, this is the dark part, and the tip of the nipple, as it is a lubricant. Don't go with the soap water. Okay, due to the soap water it will again get dry. Already due to the first in the transient soreness period, due to the hormonal changes after the postpartum, you're already having the dryness here, the tip of the nipple and around at the base of the nipple. So just apply your breast milk, or just you can apply the pure coconut oil or the olive oil also, so it will get little bit warm and the soft. Okay, you will feel the soothing effect also. Then always do the air dry. ठीक है, let the nipples get nicely air dry, so there should not be any moisture or anything fungal infection further. So you have to take all these precautions. Hello. So whenever you are feeling the nipple soreness, am I audible? Hello. Okay. So now I'm going to tell you the deep latch technique. That so this is a your breast. The baby is towards you. Okay. Just rub up and down slowly the baby's lips, and then slowly just from the backside just push the baby the nipple from the baby's mouth. So the baby will open the big mouth nicely. Okay. Now there is some questions. I am a breastfeeding mom of the 2 months old. My nipple feels very itchy and crack. How can I treat it? Okay. So when you're having the itchy or the cracked nipples, it is one of the reason that you might be having the fungal infection also. When there is a itchiness, redness, or the cracks around the at the base of the nipple or at the tip of the nipple, then it is an indication that it might be the fungal infection or the dermatitis also. Okay. So you can just consult your lactation consultant. They will guide you properly. They will give the medications according to that after the examination of the breast and the nipple. Okay. Then how can I prepare my nipple for the breastfeeding to avoid the excess pain and the discomfort? Okay. So just now I have told you regarding the deep latch technique. So it is a good method, and it is a perfect that you always follow the deep latch technique. Just do the hand expression nicely, do the massage hand expression. Just do like this. One place one finger here and here. This is a 12 and a 6, and the 12 and a 6 and a 9 and a 3 position. Always push back, then squeeze at the base, remove the few drops, then the tip of the nipple, always take the few drops and rub on the baby's lips up and down so the baby will open the big mouth. Okay. Then just insert. So this is a technique for the deep latch, and you will reduce the nipple pains while the breastfeeding. Okay. Then I experience swelling around the nipple area at the time after the pumping the breast milk. What can I do to treat the and avoid it? Okay, good question. So the nipple pains are due to the wrong flange size of the during the breast pumping. This is also one of the important reason that some mothers having the nipple injury or the crack due to the wrong size. Always while choosing the breast pump, always you have to check the diameter of the base of the nipple. So the proper, some mothers are having the large nipple and the large diameter, some others are having the small or the medium size. So depending upon that, you have to choose the proper and correct size of the flange of the breast pump. Okay. Then only, then apply the proper suction and the vacuum while the pumping also. Otherwise some others created the nipple injury because already they are having the full engorgement, the milk is full. So while the pumping also you have to do first nicely massage, then do the nipple stimulation. Just slowly roll at the base of the nipple so your nipple will get soft. While the breastfeeding and while the pumping, the nipple should be very soft. The nipple should not be the hard. Due to the engorgement, the nipple will get inside. Okay, so that time the baby is also not get able to latch properly. Same with the pumping also. While the pumping, due to the engorgement, and you start the pumping immediately on the engorged breast, the nipple will get injured and hurt. So first just do the hand expression, remove the few drops. Okay. And then start the pumping, and always go with the proper flange size of the breast pump. Okay. In that way you can just avoid the nipple injury. Any other questions? Okay. Next question is there. I'm experiencing redness and the small bumps around my nipples. Okay, how can I treat it? See, this is the breast. The dark part, this is the areola. It is having the small red bumps. This is called the Montgomery glands. Okay, this acts as a these are the secreting the lubricants. It makes the breast soft. Okay, so while the latching, the baby is easily able to catch and grasp the nipples. So no need to worry regarding this. Is a natural anatomical, this is a Montgomery glands. Okay, so but sometimes they are secreting the milk also, but no need to worry. This is a very common. Okay, so no any specific uh, cautious or anything regarding the Montgomery glands, or if you see the redness or the small bump like around the nipples, it is a common. Just wipe it with the warm water. Don't go with the soap water or anything. Just wipe with the warm water and just start direct the feeding. It will be not harmful for anything for your baby. Okay, any other questions? Okay, thank you so much. Okay, so you have to follow the basic some few points to take care of your nipples, specifically for the proper latch. Then, if still you are having after the 1 week, if still you are having the pains, means after the transition period you are having the pains, you can just consult your lactation consultant. Then do the proper investigation if there is any specific uh, redness or itchiness or so much cracks and baby bite very badly. So need to do the proper investigations regarding the baby's oral mouth also. Okay, need to see if there is a tongue tie, if you are having the flat nipples or inverted nipples. So let the lactation consultant check your breast, check the get the examination of your breast and the nipple properly. In ANC also, while doing, if you feel that you are having the flat or short nipples, don't do any nipple stimulation, nothing. Just you can go and consult your lactation consultant. Okay, you can just connect with me in the baby chakra also. Okay, then main thing, if you are having the crack and there is a swelling, if you are having the fever or anything, malaise, body ache above the 100 degree with the crack, immediately you can consult your lactation consultant, which is a very necessary. Okay, so just watch if there is any you are allergic to any detergent or any specific soap or any deodorants also. It can cause and still if you are having the nipple cracks and there is a redness or the itchy, it may cause the eczema or the contact dermatitis. Okay, then if there is a fungal infection thrust, need to check the baby's oral cavity also. So specifically if you are having anything related to the nipple, immediately you can consult your lactation consultant. Okay, the prevention is always better. Well, main thing, I'm also going to tell you that if you are having the full hyperlactation, full leakage, and that keeps you continuous moisture, and it changes your the tip of the nipple color also. Okay, so just do nicely air dry. Put the different the breast pads also. Okay, wear the comfortable cotton bra. Okay, then you have to take nicely the care of the nipples, because which is very necessary while the breastfeeding. Then while the feeding also, if baby is biting if your nipples. Okay, if we, this is very important. After once baby start teething, then baby, so many mothers telling me that ma'am, the baby is biting my nipples. So just how will you unlatch baby, because baby is tightly sucking continuously and simultaneously baby is biting also, full crack and bleeding also will be there. Just little corner at the corner of the mouth, just little finger, slowly just keep, slowly just roll. You can feel your nipple while baby is sucking continuously, and just do horizontally, and from the another corner of the mouth just slowly remove your nipple. So this is a technique and the tips I'm going to give you, that regarding baby will not bite or hurt your nipple. While same thing, while the breastfeeding also, if baby is only taking the tip of your nipple, you can feel that baby is doing the clicking sounds, or baby is not sucking properly. There is a not proper latch, improper latch, or the poor shallow latch. Just little finger at the corner of the mouth, slowly just roll, and from the another corner of the mouth, just remove the nipple, so your nipple will not get injured. Okay, so nicely you have to take care of your nipples.